When the division first started 4 years ago, it was a group of 11 GPs that came together with a vision that the care provided, whether it be through primary, community, or acute care, could really come together to form a single system that had seamless transition for patients experiencing medical care in our community.
The initial goals was to strengthen the relationship between a GP and their patients, to better support vulnerable patient populations, to help those patients who wanted to have a doctor to find one, and ultimately increase the capacity of the primary care system. So for us, for our division, that work ended up being 4 projects. The development of the John Barsby Wellness Center, a partnership with VIU to help them open up a campus-based clinic, the team, which was a group of clinicians for patients with mental health illness, and finally, recruitment and retention.
I think that the work of the board is to take the energy of the membership and translate it into policy and direction for the Division of Family Practice as we go forward in our work with our important partnerships.
I think that there is a philosophy that we share with the family physicians of the community, and that there is value in having a family physician look after interpartum issues in pregnancy, and that there's value before the interpartum experience. There's value during the interpartum experience because of our scope of practice and what we're able to provide to the family and to the patient, but also our ability to connect them to a service of family physician providers after the delivery, after the interpartum experience.
Right now we have an aging population in Canada, and also the number of facilities that are open and available is becoming difficult to get residents into those facilities. So the work is important in that we're having more complex patients ending up in facilities than, let's say, 10, 15 years ago. And so proactive care and good and best practice care is becoming more and more important.
In the UK, I was a GP, a full-time GP, and I had some roles outside of the office, but not a lot. So coming to Canada was a way for me to sort of balance what I do with my working life, and I also wanted to sort of put back in. So I was aware of the division and was invited along to recruitment and retention, and felt that I've got something to offer here.
Many of the residents do establish significant mentorship relationships during their time here. Knowing that there's somebody they can go to coffee with, that they can communicate with about items that are not necessarily associated directly with their education, but with how they're trying to formulate their life around a career in medicine has been very valuable.
We have a couple of social events every year, Splash into the New Year and an annual barbecue. And they're great events to get the GPs and the specialists, the family medicine residents and their families together. And it acts as a kind of, it's a reconnection of relationships for those physicians.
The work with the Healthy Cities Committee, as well as this upcoming expo, these are things that are very near and dear to our heart.
We are kicking off an event with Walk With Your Doc in the morning, and then in the afternoon we're having an Active for Life expo. The event will provide an opportunity for families in Nanaimo to experience the number of different sporting events that are available to families here, and it'll also provide an opportunity to learn some tips on how easy it is to create a healthy, active lifestyle for themselves and their children.
Before I was involved in the division, I could look around and think, I don't know a lot of those people. To be able to socialize together, to meet in working groups, to identify priorities together has been immensely satisfying. I look at the work we're doing with a couple of my own individual passions. Mental health is a big passion for me, and there's been fabulous work that we've done in the mental health working group, morphing into the substance use working group, in the GP for Me projects, which have highlighted those, both with team and with Barsby, which is a project also near and dear to my heart. And the support for physicians that work in the hospital has touched my life individually as well.
I think the work so far has created, has been a catalyst for bringing facility managers across, to come and meet and discuss some of the issues that they're facing, trying to overcome some of the barriers as well for physicians to enter facility on a more proactive basis.
We started off with 11 GPs in a room, and that has since grown to a membership of 183 physicians and family medicine residents in Nanaimo. So we're actually close to 100% of physicians in the community are now members of the division.
We heard that quote saying it takes a village to raise a child. I really think from a healthcare perspective, it takes a village to raise a healthy, happy adult. And that's what this is all about.
I see the division as being the center of the wheel that holds that community together.
I think we're spending more time together locally. We're bringing in excellent speakers. We're having opportunities to speak to each other and beside each other for longer times. We're having small groups at some of these conferences, and we're interacting and we're having discussions around certain cases, which is really good. So overall, I think we're becoming quite vibrant, and I think we're thriving.
I think the working group is likely to do more work in the future on practice guidelines associated with the way we deliver care. I think we will also be involved in communicating with the public, with the community of Nanaimo, about if you're considering having a baby and becoming a family or adding to your family. There's some things that should be considered in that decision-making process.
I think one of the things that's really important in our evolution is that GPs are now considered full partners at tables with organizations like Island Health. And what that means for me is that the original vision of the board of directors has now become a reality.
Ultimately, now we're at the end of 2.5 years, and we have such tangible results like clinics that have opened and recruitment and retention work that is seen as a best practice model in the province, and it's just been very rewarding.
That's the neat thing about what divisions do, is that it takes the collective vision and passions of our community physicians and helps bring them to a reality.
All GPs know they have a hard job. They have the weight of numbers behind them. The division is there to help support you, look after Nanaimo.